This is our third presentation this week for our parents, and we're all happy to be here with you this morning, going over more of the details of our reopening plan. I would like to introduce our panelists who are here, and usually what happens is they'll be chiming in and they'll be joining us throughout our presentation. So let me introduce them. So our host is Sylvie Joseph. He is our Director of Technology Operations. Thank you, Mr. Joseph. We have Jacqueline DeCero, Principal of Van Skyke Grade School. We have Karen Renessi. She is our Assistant Director for Special Programs. And that's who we have right now, and I know that more will be joining us. So again, thank you. So as I said, today is our third presentation. You can see on the opening slide, that is Principal Martinelli of Cohoes Middle School, who is giving tours to our rising sixth graders and their families. So we thank him for that, and we're glad that our parents have been taking advantage of that opportunity. Parent Square. So this is our new communication platform. And if you haven't already done so, please sign in, sign up, and you will get all of our communications. This is a wonderful two-way communication tool. We'll be pushing out messages to you from central office, district-wide, from your building principal, and also from your teachers. And in return, you will be able to also reply and send messages back. So please sign up if you haven't already done so. Especially this year, it's really important that we are in close communication, and this is one way we're going to be able to do it. We also have our Director of Facilities joining our presentation this morning, Jim Stapleton. So thank you, Mr. Stapleton. We also are updating our website regularly, so please check our website. We'll be pushing out updates throughout the year, and then we will post them to our website. So one tool that I would like to call attention to you is that at the top of the website, you'll see a toolbar. Okay, I have it presented here, and you'll see live links. Our school reopening plan. If you would like to see the entire plan, click there. Frequently asked questions. So again, we're updating this regularly. So questions that parents have and questions that we keep hearing, we want to make sure that it's part of our FAQs. Also, the governor has asked that we prominently display the COVID-19 testing, contact tracing, and fully virtual learning on our website. So if you have any questions about that, please let us know. And if you have questions about anything this morning during the presentation, feel free to email us at feedback@cohoes.org. So also, we're excited to announce our Virtual Parent Academy. We have found that this has been a wonderful way to connect with our families, and we've had a great turnout. So again, thank you. Now, I also will be presenting next Tuesday night at 6 p.m. on reopening updates. So I know it's only a few days away, but we could have updates even as soon as next Tuesday. So whatever is updated, I will regularly inform our parents, and I think this is a good method to do that. So we also want to help our families support their children in getting off to a great start to the school year through social emotional supports. So September 1st at 6 p.m., please join us. All of these recordings will be posted to our website following the presentation. So if you aren't available at 6 p.m., you'll be able to check our website and still tune in. So we will have some of our district staff who will be presenting on social emotional supports as we go back to school, whether it's in the in-person or the virtual model. Speaking of virtual, we want to make sure our parents and students have the tools to be able to navigate our technology platforms to support remote learning in the fully virtual program or even in our hybrid models. So you've heard about Schoology, you've heard about Google Classroom. Well, now we'd like to give you some lessons on how to support your child in learning and navigating our technology. So that will be September 14th at 6 p.m. Again, we will have district staff who will be presenting that to our families. And as I said just a few minutes before, if you have any questions during this presentation, or if you have questions at all, feedback@cohoes.org. Thank you. So our calendar starts, okay, September 9th is the first day of school, either in the virtual model or on site. You will be getting more information on that, what it looks like. I know principals have already sent out Parent Square messages to their families and students or through Schoology. So please continue to watch those messages. If you have any questions, feel free to reach out to us or to your building principal. So September 3rd and 8th, our teachers will be very busy. We have COVID safety training, EdLaw 2D, Parent Square, Schoology, Google Classroom, ClassLink, social emotional planning, and meeting all of the learning needs of our student as we come back to school following the closure. For our families who have signed up for the fully virtual model, we are working on a date for Chromebook and materials distribution, and we will be updating you. So maybe next week we'll have more information. I can announce that. So we are distributing only one Chromebook per family. So we'll get to that in a minute when we get to that part of the presentation. Health and safety. So one of the requirements through the New York State Department of Health, as well as the New York State Department of Education, is to have a health screening tool that is administered to our families, which include daily temperature checks. So the way we are addressing this is that each morning you will receive the health screening questionnaire through Parent Square, and we ask that you fill these out before arriving to school every day. So one big question is, does your child have a temperature of 100 degrees Fahrenheit or greater? So we're asking that you do take your child's temperature at home. So my advice would be to stock up on some thermometers. Also, other questions include, your child is not experiencing COVID-related symptoms, such as cough, shortness of breath, chills, muscle pain, headache, sore throat, new loss of taste or smell, or even a stomach ache. So also has not come in contact with someone in the past 14 days who is experiencing symptoms or had a positive COVID test. And lastly, that your child has not traveled to an area which requires a 14-day quarantine. So if the answer to any of these questions is yes, then please do not send your child to school, because then you are infecting others here. So that is very important. So now what happens once you fill out the form and it's a no response? Well, a no response to all those questions is good. Then you send your child to school. A yes response to any of those, don't send your child to school, but please contact your building principal or your school nurse. So what if you do not submit the questionnaire? I know sometimes it gets a little hectic in the morning, and mornings can be a little crazy trying to get everybody out and trying to get to work. So on those days, the student's temperature will be taken at school. But we do ask that you do send in the questionnaire as soon as possible. So the district has purchased additional handheld infrared thermometers. We are also purchasing self-service thermal scanners, which can quickly take a number of students' temperatures. So you can imagine this logistically is going to be a challenge in each one of our buildings, and that's why we do ask for your help to make sure everyone who enters our buildings is healthy on that day. So our students will engage in a video and in training from teachers on COVID safety. So the video reviews what is COVID, what are the symptoms of COVID, how should you correctly wear your mask, taking it on, taking it off, disposing of it, proper procedures for washing your hands and how we need to frequently wash hands. And we will have hand breaks. So we will have sanitizers and throughout our buildings and in our classrooms, but I'll go through that in a minute. Also respiratory hygiene and building procedures. We want our students to feel comfortable when they come back to school. We don't want them to be afraid. We want them to feel confident. And part of that is knowing what the building procedures are. So we will be reviewing this. Face covering. So you've heard a lot about this in the news. All staff and students in grades pre-K through 12 will be required to wear a mask, even when a 6-foot distance is maintained. Masks must cover the nose and the mouth, and acceptable ones include cloth masks, surgical masks, gaiters and bandanas. In the media these days and through certain research studies have been shown that they're not as effective, but still we are going to be allowing them. Face shields can be worn, but in addition to a mask. Mask breaks will occur periodically throughout the day, ideally outside. The principals are currently working with staff to develop these protocols, and we will be communicating this to our students and to our families. If a student has a medical condition and you believe that a mask exemption is appropriate, please contact Peggy O'Shea, our assistant superintendent, who will be in communication with our school medical director, and that is Dr. DeTerzi from Harmony Mills Pediatrics. So if in the case of a medical exemption, we would ask that we have medical documentation from your healthcare provider and then also a release so that Dr. DeTerzi may have a communication and be in contact with your medical provider to discuss the exemption and the reasons for that. So what if we have a student in class who maybe doesn't want to wear a mask? Well, so our advice, first of all, is start practicing at home. Start practicing wearing masks at home whenever you go out in public, and I'm sure you're already doing this. And I'll try to stress the importance of why we are wearing masks once we leave our homes. So that will definitely help us in school. So if there is a problem, we will try to figure out what is the issue here. We will work with your child. I don't want anyone to worry about that. We may call in the principal or the nurse if additional support is needed. We will be providing disposable face masks for our students, but if you would like to send your child to school with one of your own, that's fine. That's fine. So any acceptable face mask or face covering and also clean face coverings. So masks are required to be worn on the school bus during transportation. I did get some emails regarding CDTA transportation for our secondary students, and we did announce last spring during our budget deliberations that we were not able to include CDTA in our budget for this school year. So I'm very sorry to announce, but that will not be an option. So we will not have those shuttle buses and we will not have those bus passes this year for our students. We're hoping that financially things improve in the following year, and we might be able to include that again. So we've gotten a lot of questions about, well, why masks? I don't understand. If we're 6 feet apart, why do my kids have to wear a mask? So I think when we look at the tools schools have to mitigate a COVID spread or exposure, Face coverings are one of the most important tools we have. Obviously, social distancing, yes, but also face coverings. So that is our goal, to ensure everyone's safety, and that's why we are requiring them to be worn in the classrooms, even when we are maintaining a 6-foot distance. When students go outside, they may take their face coverings off. Um, so that is our reasoning. Again, we're trying to keep everybody healthy, and masks are an important part of that. So thank you. We thank you and appreciate all of your support in that. This has been another really popular question, and rightfully so. So what if my child on any given morning appears to be fine? You take your child's temperature. Your child doesn't have a temperature. Okay, you answer those questions, and the answers are no to each one of those questions in our health screening questionnaire. But the teacher notices, okay, something might not be right. So in that case, it could be a student self-reports to the teacher, I'm not feeling well, or the teacher may say, you know what, why don't you go see the nurse? So in that case, we do have a separate room we're calling the health safety room, and your child would go there for evaluation. The nurse would be in, again, PPE, full PPE, take the temperature of the child, and also determine whether or not there are symptoms of COVID. So let's say that the child has a fever, or there are symptoms of COVID. In that scenario, the nurse would call you immediately to come pick up your child. And again, we request that you do come as soon as possible so that we don't spread any kind of germs here. So then once you arrive, again, to the front of the building, the nurse will escort your child out to meet you. So how do you come back to school? Well, there are a number of scenarios. So let's say here that you take your child. Again, we will recommend that you take your child to a healthcare provider. So let's say you take your child to your own healthcare provider, and the test comes back negative. So in that case, again, please notify us, because it's important for us to have information if there is a positive test. So in the case of a negative test, please notify us, and your child may come back as long as the fever has subsided, fever-free, for 72 hours, in addition to no symptoms. Okay, no symptoms. So that's one scenario. Another scenario is, and that also, so in this scenario, let's say the test comes back positive. So again, please notify us right away, and you must defer to the Albany County Health Department. So your child may return, again, fever-free, 72 hours and 10 days since symptoms first appeared. Let's say you don't go to your healthcare provider and there was no COVID test. Then your child must be fever-free for 72 hours, and 10 days must have passed since those symptoms first appeared. There is a little controversy here. Well, what if I get a note from a doctor attesting that my child does not have COVID? So we are getting clarification on that scenario, because many of these COVID-related symptoms do sound pretty insignificant, like a tummy ache, runny nose. So in that case, we're still waiting for clarification, because we're not sure if a doctor really can make that judgment that somebody doesn't have COVID at that time. So again, that's something else that we'll continue to update you on. So what if there is a positive or suspected case of COVID in the school? All right, so again, please contact us immediately, okay? Because we are required to follow certain protocols. So the very first thing, let's say you call your principal then your principal calls me, and then I will call the Albany County Department of Health, and I will also call our school medical director, Dr. DeTerzi. We will immediately implement contact tracing. So that means we are going to identify all of the affected classrooms, all of the affected areas of the building, all of the individuals who were exposed. And then in conjunction with Dr. Whalen from Albany County Department of Health and Dr. DeTerzi, we will determine the extent of the closure. Now in our buildings in elementary, we have our students segregated into pods. We're trying to limit their contact with other students in the building to keep them pure. In that regard, we may only be closing that pod, and the students in that pod will need to quarantine for 2 weeks, and the teacher as well. In the middle school or the high school where it's not as segregated, the number of students who will be quarantining will be greater. So that is something that through contact tracing we will be able to identify, and we will communicate any positive case to our school community. We want you to be aware of what is happening in our schools, and we will also notify everyone of the closure. Social distancing. Again, remember I talked about what are the tools that the schools have to mitigate any kind of COVID exposure or spread. Okay, this other tool is social distancing. So we have health screening, we have masks, we have social distancing. So we are utilizing multiple entrances for arrival and dismissal in all of our buildings. Our principals are working on strategies for minimizing hallway traffic, and any kind of contact during the transitions. And that's mostly for secondary. Again, as I'm sure you have heard, all students will be spaced 6 feet apart in our classroom. Lockers and locker rooms at the secondary level will not be used, and cubbies at the elementary rooms. Some of them had to be removed so that we could accommodate the maximum number of students in these classrooms while maintaining a 6 feet distance. So we are working to identify alternatives on placements of coats and book bags. So at this time, I'd like to ask if any of our principals would like to join in and maybe say a few words about maybe arrival and dismissal, or any other strategies that you may be utilizing in your building to ensure social distancing.
Hi, Dr. Spring, and to our parents. This is Jacqueline DeCero, principal of Vanscoy Grade School. We will be utilizing the 4 entrances, 2 in the back for our UPK students, and then in the front, we'll have the 3 entrances, which we typically have, but what will be different this year is we will be putting 6-foot place markers out in front of those doors. So we'll be going further back, using more of our sidewalk to make sure that when the students are lining up at the start of the day, that they are maintaining, there are spots for them to know where 6 feet distancing is. And then once the doors open, you'll come in and the teachers will bring the students to their classroom, and there will be grab and go breakfast that will be there for them.
Wonderful. Thank you, Principal DeCero. Any other principals?
I know Mr. Perry and this is Mr. Bird. I know Mr. Perry and I are both working on 3 separate entrances for our students. At Abram Lansing, our kids will be entering where they dismissed all of last year. If you're new to the building, that means 4th and 5th grade will be coming in the main entrance. Grades 2 and 3 will be down by the playground. It's the door that we used all last year for everybody to come in. And then kindergarten and 1st grade down at the south end, which is nearest the big parking lot. So I would suggest that grades 5, 4, 3, 2 drop off where we always did, right in front of the building, and kindergarten and 1st grade parents can drive around the perimeter of the big parking lot to drop their students off there.
So, Mr. Bird, I do have a question here, and since we have you on the phone right now on the line, The parent is asking about, what is the temperature range for students to go out on the playground? I know that students will be eating lunches in their classroom at the elementary school. They will be going outside for recess. But I mean, how cold or when would we not send students out? Or an inside day or outside day?
Is this a trick question?
It's not a trick question. The parent is asking. Yeah.
Well, what we consistently say here at Abram Lansing is dress for the weather, because we're going outside unless we're going to freeze to death when we get out there. So we do kind of look for, obviously, wind chill factors and advisories from the weather department. But we go out as often as we can, just especially now, so we can get outside and take our masks off and get some fresh air.
Thank you. I think it's great. We're already talking about bad weather. So I think everyone's confident in opening and being able to stay open this year. So that's great. And who knows, we may not need to have snow days anymore if we can work virtually. So that's one good thing we can say right now about this pandemic. Okay. So, health and safety, materials and supplies. Shared books brought home must be quarantined for 72 hours upon return. So, let's say your child has a book, brings the book back, then we will keep those books in a separate location for 72 hours until, and then we will give them out and pass them out to the next student. So, paper-based assignments only will be handled by the individual student and teacher, with the teacher washing hands after handling each paper. We will not be mixing papers, so maybe we'll be using folders. And if materials are shared, we will be wiping them down between use. Desks will be disinfected and sanitized after students leave each day. And between classes, staff and students will wipe down the student area. That's mostly at the secondary level. Ms. O'Shea, our assistant superintendent, is joining us as well. I don't know if you have anything else you'd like to add to that.
So what we are also doing is there also will be some computer-based assignments to minimize this, especially at the secondary level. I know at the secondary level, Schoology is utilized, and then we're coming up with protocols for all the paper-based assignments, as you mentioned.
Thank you. All right, our facilities. So again, our facilities were built. I think our oldest building is 100 years old. That's our middle school. And then our newest building is Harmony Hill. And I want to say that was a good year, 1985. So we are doing our best to have, and I'm going to have Mr. Stapleton talk about our ventilation in these buildings in just a second. But cleaning and disinfecting protocols. Commonly touched areas, door handles, desks, and tables will be cleaned and sanitized daily and nightly. We have fully implemented the CDC enhanced cleaning and disinfecting protocols, and building automation systems will be utilized to increase the flow of outdoor air to the maximum that temperatures will allow. Filters have been changed, coils have been cleaned, and commissioning of the system is underway. And we have also repaired window screens. So Jim Stapleton, our Director of Facilities, would you also like to comment on cleaning protocols and ventilation in our buildings?
So one of the things I like to mention when I have the opportunity about the ventilation is the HVAC system was engineered to be in the schools. Every school in New York State has the same equipment that we have. So it does bring in outside air and it does exhaust air. So we're going through, we're making sure every piece of equipment is operating the way it's supposed to. So just have peace of mind that the HVAC systems will be working. The cleaning is going to change a little bit, where everything has to be more on a schedule and it's kind of a checklist. So still working on that a little bit. It's not going to change that much for the second shift employees, but it will change a lot for the day shift. just more regimented of what time things are going to happen. So that's about it.
So Jim, I did get a question about, what happens if there is a positive case and we are closed, let's say in that classroom, that pod is closed, let's just say hypothetically elementary. So then what would happen in that classroom as far as disinfecting?
So what we're using right now is backpack sprayers to, if we have a positive case, where we can go in and we can spray down every surface. Obviously, you can't spray the technology that's in there. So it'll be a quick response where we get the chemical on every surface, let it sit there for its proper dwell time, and then we'll isolate the area. So we'll have to still working with principals as far as what happens with the kids in that space, but we're ready, we're prepared.
So you did talk about technology. So in the case of some shared Chromebooks, what is our procedure for cleaning the Chromebooks in between student use?
I think right now we're asking the faculty and staff to help out with that.
Is Sylvie Joseph on the line with us?
I am.
Can you just comment
And
about what
like
that
Jim
looks like?
said, yeah, like Jim said, that's exactly what it's going to be. It's going to be the use of cleaning wipes. Obviously, we don't want to use anything corrosive or anything on the Chromebooks and technology, but at the same time, we have to use what's available to us. We've got the cleaning wipes that we've been using throughout the closure and over the summer, and I know we've got some alcohol-based wipes on order, as well as the BOCES order that Stacy Mackey has ordered. I don't know the timeline on delivery. The alcohol-based wipes that we've ordered, supposedly sometime in September they should arrive, but the BOCES order I don't know.
Thank you. Okay, more about facilities here, hand and respiratory hygiene. So we have signs all around our buildings to serve as reminders to our students and staff about mask wearing, about washing hands. Students will have hand breaks during the day so that we make sure our hands are clean, especially before lunch, before eating. So that will be a priority. We do have hand sanitizers in every classroom, at building entrances, and in all of our common areas. So I did talk about contact tracing. So another thing is testing. So what if my child does need to be tested? In that case, again, we would recommend that you see your own healthcare provider. But if that isn't a possibility, then Dr. DeTerzi at Harmony Mills Pediatrics here in Cohoes it will be a testing site and will be able to assist families. So we also wanted to thank her for that. So if there is a positive case, then we will trace, as I mentioned before. So part of this is keeping accurate attendance records, who is in our buildings, when are the people in our buildings, up-to-date student schedules. And we do have visitor logs with health attestations, those same questions again, stationed at the entrances of all of our buildings. So visitors, what does that look like this year? So visitors to our school buildings will be restricted to those required for essential school business only. Parent meetings will be held virtually, but we promise if there is any health or safety, emergency or concern, we will definitely have you in the building. So I don't want you to worry about that. Use of bathrooms, we are arranging staffing with the goal of positioning teacher aides outside of bathrooms to ensure that usage is limited at any one time. Outside learning, so this has been a big question about, well, can we take our classes outside? And our teachers are excited to do this, and I think it's a great idea. So that is something you'll hear about from your child, that we went outside. We were outside for a lot of the day. So I know there was a question about, what about drinking fountains? So we do have refillable water stations that we do encourage you to send a reusable bottle to school with your child. And and your child will be allowed to refill the bottle. Jim, did you want to say anything about those? Where are they going to be located, the refillable water stations?
The bottle filling stations are going to start in the cafeterias. And if we can pick up enough, we're going to try to get some on each floor of the building. Everybody in New York State is trying to obtain the same things we are. So there's a backlog and it's not available. So we're looking at changing some of the bubblers on the water fountains out to more of a faucet where a kid's mouth wouldn't be by it, but they could fill up their bottle filler out of a water fountain. That's just a temporary response. It's not our permanent response. We will have places to fill their bottle, and I believe we're going to have, for a limited time, bottled water available. That's more of a cafeteria, Brian Nolan. But I believe we will have some in case it's needed. But I don't think our plan is to continue with that for very long.
Okay, well, definitely through the warmer temperatures. So that sounds like a great plan. Thank you for that. As I mentioned before, we have established and identified health safety rooms in each one of our buildings. So if a child is experiencing symptoms of being sick, then the student will go to that area for evaluation with the school nurse. They're located inside the nurse's office at the high school, middle school, and Harmony Hill. At Lansing and Van Skyke, they will be located in the main office conference room. So let's say your child gets meds, so your child will report to the nurse's office, and we're trying to not mix students who are sick with students who go to the nurse's office for meds or for, let's say, a Band-Aid or for issues such as that. So we are looking to have those students maybe go to the entrance or meeting the nurse in a different location near the nurse's office so that we can, not expose those students in case there is someone in there who is experiencing symptoms. So we're trying to segregate those cases. So we will still have our fire drills, our lockdown drills, and our evacuation drills this year because we need to continue to prepare our students in how to respond to an emergency. But we will be training our staff on how to conduct them in a manner that maintains social distancing at our exits and our gathering points outside the building. We are looking at increasing safety measures since more classes will be outside, seeing if we can give some more radios, hand out radios to teachers who are outside, and seeing if we can utilize safety officers at those buildings where we do not have them. Additional workspaces for our staff. We've created some of those so that we can accommodate social distancing for our teachers. So we want to take care of our teachers as well, obviously. So what does it look like on-site learning? So K-5 will be on-site daily. Speaking of kindergarten, I did get a question yesterday actually about, well, what does kindergarten orientation look like this year? What does it look like if you're a virtual student or an on-site, going into the on-site program every day? Could we just have one of our principals comment, one of our elementary principals comment on what that looks like this year? Mr. Bird?
I can
Oh,
speak.
thank you.
Yep. At all three elementary buildings, we are planning on still having our kindergarten screening. Typically, this is done when the students are in UPK, and if they're not in UPK, we usually do that in the spring. Obviously, we were unable to do that. So our plan right now is that we're going to be calling and scheduling individual kindergarten screening times for each family during the days of September 9th, 10th, and 11th. The parents will bring the child to the school. The parents are going to have to wait outside while the teacher will meet their student at the door, greet the parents, bring them to the classroom so the child can see their classroom, do the screening, and then the teacher will then return the child to the parents who will be waiting outside, and then any questions can be answered by the teacher then. They are planning a virtual open houses as well.
Thank you. So can you also let our families know again, when is the first day for kindergarteners and when is the first day for pre-K as well?
Right now, because with the screening, we are planning for both kindergarten and UPK to start on Monday, September 14th. And just a little note that we will be doing screening for our UPK students as well.
Thank you. Thank you. So as we had mentioned previously, we have added sections district-wide in our elementary grades to reduce class sizes again, so that we can maintain a 6-foot distance in each one of our classrooms. Now this may change a little depending on the virtual learning model, the fully virtual model, because we are looking to transition or change some of these classes into virtual classes. So we will be letting you know about that hopefully next. So students, as I
Yeah, and
said, are
Dr. Spring,
grouped
we
in.
should let our,
Yeah. Go ahead.
we should let our elementary parents know that because of working on virtual classrooms, we don't have classroom
List.
our list, thanks, set up yet. They've changed multiple times over the summertime. So as soon as we know, we will let the parents know. And if you haven't yet, say Parent Square about 17 times before we're finished here.
So thank you for that, Mr. Bird. So we do, our goal is to be able to let parents know about class, their class assignments, September 1. That is our target date here, but I do want to underscore that by setting up a fully virtual model, that's why we are delayed in this process this year, because this is an extremely huge and monumental task for us. And we're doing it very, very quickly. So we just closed the survey last night, or actually Tuesday night. And so now we're looking at all the class sizes and we're looking to convert some of those classes to virtual. So this is a big process, complicated process. So thank you for underscoring that and letting our parents know, Mr. Bird. So again, we are in pods this year. So special area teachers will travel to classrooms to provide instruction. AIS teachers will push into classrooms, and special education teachers and related service providers will push in as much as possible. I'd like to call on first our Assistant Superintendent, Peggy O'Shea, to comment on the special area teachers as well as AIS teachers. And then we can have Karen Renessi, our Assistant Director for Special Programs, talk about special ed teachers and related service providers.
Yes, hello. So I'm actually meeting with physical education teachers this afternoon. As Dr. Spring said, they will push into classrooms. However, physical education will be outside as much as possible. When inside the classroom, we're going to make sure that there are activities that require no physical contact, some different games. We understand the importance of movement throughout the day, though, not just in physical education, and our planning for that. And with our art and music teachers, actually, we received a grant for art supplies, so we will not have to share materials. We've been also working with our AIS teachers, so they will be pushing into classrooms to meet student needs. And again, small groups can also be brought outside for instruction at this point in time. Mrs. Renessi?
Thanks. So for special education, consultant teachers will be able to continue to provide services within the classroom. For students whose IEPs indicate special class reading or math or resource room, as Dr. Spring said, our class sizes are going to be smaller, so we might have some flexibility to have some space in the classroom to be able to pull students aside. I know parents have discussed with me their concern if their student is highly distractible, that could be difficult for them. In that case, we are looking for at the possibility of taking students out of the classroom, but only to a very large area. So maybe outside or a large area within the school, And if that's the case, we'll have a protocol to disinfect between groups, really trying to keep students in their pods as much as possible.
Thank you. So as we did mention, breakfast and lunch will be eaten in the classroom at elementary, and we'll have grab and go breakfast at the entrances, so students can grab that, bring that to the classroom and eat it. Obviously, you can't eat food with a mask on, so that obviously students would take their masks off at that time. Lunches will be delivered to the classroom daily. Students will still have recess. Then after that, we'll have aides covering those lunches, and we will have designations of peanut aware rooms where there are known allergies. So secondary, we are on an every other day schedule here. We've divided our student body into half at both the middle school and the high school. We have a blue team and a gold team. So when the blue team is on site, the gold team will continue learning at home. So what does it look like learning at home? Well, that's the at-home learning day. And on that day, lessons will be self-guided. Assignments will be posted through Schoology or handed out during in-person classes the day before. Your child may view a video. There may be lecture notes that are posted, reading and writing activities, and even exchanges through our online discussion boards. Students will get a numerical grade, and that is how we had been doing grades prior to the closure, so we will revert back to that model. And principals are working with staff on how we are going to track attendance for this day, and we will be updating our families. So one thing, I do have a question here. So what happens for the in-person students if there is a transition and that we have to temporarily close? What does that look like? So let me first go over what the fully virtual model looks like. And in the case of a closure, then yes, we would all revert to and transition to a fully virtual model. So we are still working out those details. Closures could be just one class working virtually, again, depending on who has to quarantine, or it could be larger. It could be a whole building. And in the case of the governor's directives, it could be the whole district. But we're still working out those details. So the results,
Dr. Spring,
yes,
oh, I'm sorry, this is Peggy O'Shea. If I could just mention though that the teachers during the professional development days will have their Google Classrooms and their Schoology up and running. They'll be teaching children during the first weeks of school how to utilize these platforms, how to submit assignments. And as Dr. Spring mentioned earlier, we will have the Parent Training Academy. So we will be prepared for it when this happens.
Thank you for that clarification. Okay, so here are the results for the opt-in survey to the fully virtual model. So you can see 437 students district-wide. So that's roughly 23-24% of our student body. And while we firmly believe that an in-person learning environment is best for every child, we do understand that this year is not the best decision. That was a hard decision and may not be the best for certain students and families. So we're happy that we are able to offer the fully virtual model. We are continuing to work out the details, as we had mentioned earlier, for the elementary. So let me talk a little bit about that. So students will be expected to connect online with their class and their teachers according to the following schedule: 9 a.m. to 2:45. That is the length of the school day, an hour off for lunch. So 2 hours ELA, 1 hour math, 1 hour 45 minutes divided among science, social studies, or social emotional learning, depending on the day. Specials, art, music, and physical education will be self-directed and will be project-based. Participation in these areas can occur during the lunch break or after school. So students will be grouped by grade level, with students joined from the district's 3 elementary schools. Zoom and or Google Meets will be the meeting platform. Again, we'll train our parents and our students and how to access these. Google Classroom will be continued to be utilized for students to access materials and assignments. As I mentioned earlier, we will have a distribution day where you can pick up your textbooks, your workbooks, and special education students and our English as a new language students will receive direct and indirect support. Attendance will be taken. Again, we are required to keep attendance every single day, whether virtual or in person, and so we will be doing that. So at the secondary level, so middle school and high school students in this program will be assigned again to a blue team or a gold team. They will alternate every other day, almost similar to the in-person model, between live instruction, we call that synchronous with their teacher, and asynchronous, which means not live or self-directed, with lessons that are recorded or posted online. During the synchronous instruction, students will be expected to be online according to their period-by-period schedule. So just as our secondary students receive a schedule, okay, if you're in the in-person model, you will also receive a schedule if you're in the fully virtual model. So virtual sections of these classes are being created, and we are not mixing at this time. We are not mixing our virtual and our in-person classes. We are placing an emphasis on ELA, math, science, social studies, and world languages, and our Regents courses. And every effort will be made at the high school to offer virtual opportunities in advanced courses and electives. However, due to staffing and enrollment considerations, not all courses may be available in the fully virtual model. We are still working on this. I want parents to know we're still working on this. At the middle school, art, music, and PE classes will be more project-based and self-directed. At the high school, PE, I believe, is going to be fully asynchronous as well. And period by period attendance will be taken. Again, we are required to take attendance, and so we must have that in place. So Chromebooks. So again, we've purchased an additional 550 Chromebooks. There are some issues with the supply chain. Sylvie, Mr. Joseph, can you talk, if you're still available, about maybe what are some of those issues and what we're doing to try to ensure that we do get our shipments in as soon as possible? Mr. Joseph, can you hear me? We can't hear you. Okay, he's working on that. So you are aware we sent out a survey through Parent Square. Again, we're mentioning Parent Square again. And we wanted to inquire. So how many devices do you have at home? What is the access for your child or for your children? What is the need in your home for an additional device? And what about your internet? Do you have it? Is it reliable? So those are some of the questions that we ask. If you have not completed that survey, please do so. So we have this information. I know that we have about 1,000 completed so far. We appreciate everyone's, input in that and access and completing the survey. So thank you for that. Working to get device donations from area businesses. Again, we wouldn't be servicing any of these computers, but we are looking to get donations that could be made directly to our families. We did purchase some MiFi hotspots for some of our students. And also BOCES is working with Spectrum to be able to offer home internet at an affordable price for our families. So, Mr. Joseph, are you able to join us? Okay, I think he's having access issues. So we are hoping that we can have the rest of these Chromebooks delivered by November. I know that doesn't help us in September, November, December.
Can you hear me now?
Yes, I can hear you now. If you could just talk about the Chromebooks, and also if a parent would like to purchase a Chromebook personally for his or her own child, what does that look like?
First of all, on the Chromebooks and the delivery that we've already purchased, we had somewhere in the neighborhood of 500, 550 devices, give or take, that we had purchased end of May, early June. And thus far, we've only received 58 out of the 60 that were designated for the middle school. And it's not really supply constraints are obviously a problem because, all over the world, Chromebooks are in high demand. But the issue that affected our shipment is the U.S. Department of Commerce had put some sanctions on China and some of the manufacturing facilities that were producing these devices for human rights violations. So as a result, a lot of the shipments that were coming from those plants have been sent back or are being rerouted to other facilities to complete the production and then obviously ultimately the shipment. So at this time, I don't really have an accurate delivery date for them. Best estimate right now is mid-October, early November. When that was announced, I had looked at other vendors, manufacturers, brands, whatever you want to call it, and everybody's in the same boat in terms of delivery times. Not necessarily because of the sanctions, but just because of the high demand. We looked at Dell, we looked at HP and all the other different brands out there, and it's moving to a different or shifting to a different manufacturer, whatever. It could be an increase in cost, or it could be just that the delivery times are about the same, or even further into 2021. So it didn't make sense to shift. And right now we're just hopefully optimistic that we get something in October or early November. As far as devices, if parents want to go out and purchase their own for their students, I've said this time and time again, a Chromebook is a Chromebook is a Chromebook. You can get a Dell, you can get a Lenovo, you can get a Hewlett Packard, Acer, Asus, anything that's out there, and they'll all function, in terms of what we need to do and what the students need to do, they'll all function similarly. You just want to ensure that it has a webcam and built-in microphone, and you'll be fine. They range in price anywhere from $150 up to $500, $600, $700 even. Obviously, you don't need something with all the bells and whistles, just enough to get the student and their work completed.
So would you say going through Amazon or locally, where might someone go locally?
Wherever you can find one, Amazon, Best Buy, Target, any retail outlet that offers them or has any in stock.
So that might be an issue. The supply chain may also affect parents' purchase as well. I know that we did have a staff member mention that Walmart does have refurbished devices that they do sell. So that also might be an option. So something to check out. So thank you. So here's a question, I'll get to that. Some medical health questions I'll get to in a minute. So let's continue here. Let's see what we have. Oh, questions. Wow, that was fast, everybody. So let's get to some of the questions. Again, if you have a question or a comment, please feedback@cohoes.org. I'm answering them right now, or we'll get back to you if you have a question you think of after we're off our presentation today. So what education will my child be provided while we wait for test results or while we are waiting for symptoms to end? So that's a great question. And we are still working out the details. So that is something we're working with our Teachers Association on, and on what the learning will look like for those students, because I agree, we don't want sick kids in school. That's not good for anybody, but obviously we need to make sure that students can keep up with their learning. So keep up with the class. So that's something we're working on, and hopefully I'll have answers in the coming days for that. Here's another question. what happens if my child has a basic cold? Can they go to school? So the answer is going to be no, because a basic cold, again, does mimic symptoms of COVID. So we would ask that you don't take your child to school and have your child infect other students with the basic cold, but we don't really know if it's a basic cold. So that is why we also need to be able to inform our families of when a child is home, not going to school because they're sick. For whatever reason, we want to make sure the child can keep up with his or her classmates. So those are details we're still working out. Here's another question. Are there going to be staggered drop-off and pickup times at the elementary school? So we are not having staggered drop-off and pickup times, but we are using different entrances. Do any of our elementary principals, would anyone like to join in and talk about maybe the social distancing in place at drop off and pick up so we can assure parents? Is there anyone who can talk about that on our call?
All three of us have worked on making sure we mark off the 6-foot distancing as the students line up. They're not going to be lined up for long either. We'll have somebody walk out the door 5 minutes before. The teachers will meet them at the door. So it'll be 5 minutes of just kind of organizing to get them in the doors as efficiently as possible.
So what time should parents at the elementary levels drop off their children, and what time should they pick them up?
School starts at 8:35. We're opening the doors at 8:30 in the morning. And then I have to double check my contract now, but I think it's 8:40. All right, sorry.
You need water.
Yeah, that's what I need. I think it's 2:40 at the end of the day.
All right, thank you. Okay, and here's a question. Is the expectation that a child is tested every time they present with a runny nose or stomach ache? This seems like a lot of waste in our testing capabilities. So first of all, I do know they're coming up with a new kind of test that's very quick and it's rapid. And I think that will be a game changer, so that I think we all agree that testing as many people as possible will help to contain any kind of spread. So that is something that hopefully Dr. DeTerzi will have that latest equipment beginning September in her office. So she will be able to help anybody out there. So the question is, yes, if a child presents with a runny nose or stomach ache, we are recommending testing so that we can rule out any kind of positive COVID result. So I know that that's going to be a lot this year. I do know that. So, but one thing Dr. DeTerzi did say that because people are social distancing, because people are wearing masks, because people are staying home when sick, that she's not seeing all of the sick kids in her office right now. So since the closure. So I think that by abiding by these health and safety tactics that we're using and strategies, I think we will see fewer students who are actually sick with some of these usual childhood sicknesses. So I am hoping for that. All right, and here's another question. And this one is going to be for Karen Renesi. Karen, Mrs. Renesi, are you still with us? Yes, okay. So how will speech services work with students wearing masks?
So we have ordered masks that have the clear panel. And that is going to be for both the speech therapist and for students whose main focus in their therapy is articulation. So both the therapist and the student will be able to have the mask with the clear panel so they can see each other's formation of the sounds as they're speaking.
So will each student have his or her own designated clear mask?
Yes.
Okay, very good. Very, very good. Thank you. Thank you. Okay, are there any other last minute questions? Going once, going twice? All right, in the meantime, I see we have our athletic director, Jeff Huno, with us as well. Mr. Huno, any updates on athletics for our secondary students? Well, at this time, I do know that.
Good morning.
Okay,
I'm sorry.
good. Okay, great. Thank you. Thank you, Jeff.
Yesterday, Governor Cuomo announced that he will be giving guidance on high school athletics sometime next week. So we're just patiently waiting his guidance on whether or not we can return to sports.
Okay, so hopefully we'll have an update next week and we can let our families know about that.
Yeah, the plan right now is September 21st is the start date for fall. But again, that all hinges on his guidance next week.
Wonderful, thank you. So are there any other closing statements from any of our directors or our principals? All right, very good. So I will tell you that our first parent virtual meeting we had July 29th, we had about 125 attendees, parents joining us. On Tuesdays, this past Tuesday at 6 p.m., we had about 40. And yesterday we had about 14. That was the 3 p.m. time slot. This morning we had 31. So I would say that the 6 p.m. and the 9 p.m. Time slot in the morning are the most popular, so that's good information for us to have. And I also think that the number of participants has dwindled only because I think people feel that their questions are being answered and they're able to make decisions. So that's all positive. So please let us know if you have any other questions, and we would be happy to answer them. So feedback@cohoes.org. Thank you so much, and we are very grateful for your support and your partnership. So have a wonderful day, everyone, and feel free to join us again Tuesday at 6 p.m. Have a great day. Thank you. Bye.